Hi, this is Dr. Teresa Anderson with Psych Waves. I am a practicing adult psychiatrist in outpatient world in Cincinnati, Ohio for the past 15 years. And with us on the podcast today, we have Dr. Helmer Figueiredo, a dear friend of mine from Hello Mental Health. He does ketamine assisted psychotherapy. As you guys know, we do ketamine infusions for treatment resistant depression, anxiety, and PTSD. And so these are the guys who help us out in between those infusion sessions and help the patients sort of unpack everything that went on during the infusion. And so, Dr. Helmer, thank you so much for being with us today.
Thank you for inviting me, and thank you also in the name of Hello Mental Health. I'm very excited to participate in this podcast.
Fantastic. So, you have a very fascinating backstory that I don't think a lot of our listeners know. I think is super cool. Can you tell us a little bit about that?
Well, the first one I think is I was born in Brazil and born and raised in Brazil. So because of that experience, now being born in Brazil, I'm very open to cultural differences. I'm here in the United States doing therapy for potential individuals who are have a different background. For me, a historical background, life background, and I this for me makes therapy even more rich. I'm very interested in diversity in psychotherapy. So my native language is Portuguese. I learned Portuguese, and then I learned French, and English is my third language. So it's an honor to be working here in the United States doing psychotherapy. I went to medical school in Brazil. Even early medical school, I was already very interested in the mind, behavior. Uh, how is the mind connected to the brain? How are those two put together? I don't think anybody has been able to solve the question yet, it'll be a matter of time, but I've always been fascinated. So I was very active in neuroanatomy, helping my neuroanatomy professor in medical school. I also shadowed in emergency medicine and surgeries. And very interesting at that time, I was also very interested in female mental health. So I took gynecology classes and I had some ambulatory experience in gynecology and so forth. In addition to that, I dedicated a lot of time in the psychiatric hospitals and I enjoyed early on working with individuals. At the time, the individuals had more psychotic disorders like schizophrenia or depressive disorder with psychotic episodes. Uh, because of my interest in research and interest also to become a university professor in Brazil, we did not have the MD PhD program. So I came to the United States to get my PhD, which I got my PhD in neuroscience at the University of Kentucky. I worked on neural connectivity and neuronal cell death and how the nerve cells connect with each other. And I was primarily trained as a molecular neurobiologist, and I did a lot of molecular neurobiology research. After my PhD in neuroscience, I did a postdoc. I was a postdoctoral student at University of Cincinnati, and during those postdoctoral years, I studied under Dr. James Herman on stress regulation and the HPA axis, so directly applied to issues of anxiety and depression. So the two major areas that I focused on was how the frontal cortex regulate cortisol levels, and all this work was done in experimental animals, rats, how the frontal cortex regulate the cortisol levels in those animals. And second, as I mentioned earlier, because of my interest in female mental health, I was also very interested in studying sex differences. Even in the rats, we have differences in cortisol regulation, cortisol levels. Uh, in humans, this is more clear when you see that depression, for example, is two times higher in females compared to males. And this is not just due to social factors. Social factors play a big role, but also due to biological factors. And my research was very focused on the biology behind those sex differences. So I studied as how estrogen and progesterone regulates the levels of cortisol at both at the level of the brain by activating genetic mechanisms, and neurochemical mechanisms of the brain that will regulate levels of corticotrophin releasing hormone, adrenocorticotrophin releasing hormone, and so forth. And also through direct mechanism acting the adrenal gland, because the adrenal is the organ that will restore and release cortisol after induction of stress and secretion of adrenal corticotrophin releasing
For our
hormone.
non-medical listeners, the HP axis is the hypothalamic pituitary axis. And what Dr. Helmer is talking about is in terms of like how is this affecting cortisol release, which ultimately affects how you react to stress, right?
Absolutely, absolutely. And thanks for clarifying that. Yeah, so basically the HPA or hypothalamic pituitary adrenal is the axis in the body that will regulate part of the stress response. One, when somebody gets stressed, there are basically two systems. One mediated by the sympathetic nervous system with the release of adrenaline, and this is the one that people commonly know. This is a very quick, very fast response, and the lab is very challenging when you do the
So fight or
measurements,
yeah.
but the techniques, because the levels go up and down really quick of adrenaline. The second huge mechanism, which is now the one being heavily studied, is the release of cortisol. When somebody is stressed, we have a slower response in the humans that will peak with like 10, 15, 20 minutes, and you have higher levels of cortisol. This cortisol that is released by the adrenal will go back to the brain and will directly bind to cells in the hippocampus that regulate memory, and they will bind to cells in other brain regions that regulate emotions. And when we see differences in levels in female and difference regulation in female, we, as a consequence, see differences in emotionality, in memory, in perception of situations, and so forth. So this is what I was studying.
Yeah, that's why a lot of my patients who suffer from post-traumatic stress disorder believe that they have early onset dementia because their memory is not good. A lot of that
Yeah,
cortisol
yeah.
is actually blocking long-term memory storage in the hippocampus.
Yeah, and one of the amazing things, I mean, the body is just fascinating, is that all of these responses, all these emotional responses, they are not random. There are biochemical mechanisms that mediate those responses, and they are very tightly regulated, and they are also co-regulated with other factors. For instance, let's say with the sex hormone, when we have an increase in estrogen, at least in the animals, we see increase of cortisol levels. With testosterone, it'd be more the opposite. When there is an increase in cortisol, we see a decrease in testosterone and vice versa. So in all of those molecules, all those chemicals are very tightly regulated in the body. And I was fascinated by those regulations that occur and the implication on mental health.
So how did you wind
So
up doing what you do today?
because I missed terribly like working with the patients. I love the research. I was very productive in research, but I still miss the patient, contact, and I enjoy the interaction and learning about the person. At the time, I had the chance to either go back to Brazil and do my whole residency in psychiatry, and or engage into what I did, which was a PhD, another PhD in clinical psychology, because I had already developed, even through the research, I was already very interested in psychotherapy. I decided to follow the psychotherapy route, and here I am. I went to Xavier University here in Cincinnati, where I got my PsyD degree. And when I finished my PsyD, I went to the Orlando VA for my internship down in Florida, and I stayed there for the next 7.5 years, where I gladly work with the veterans. I was a inpatient psychologist at first. I was one of their first inpatient psychologists, and they became the only inpatient psychologist at the time. So I was there for almost 3 years as an inpatient psychologist, working with the patients with many problems, with psychotic disorders, bipolar disorders, um, alcohol issues, all acute issues that required hospitalization. And after the inpatient psychology, I went and became an outpatient psychologist, which I continue to work, but now in long term doing psychotherapy and also assessment. At the time, I was also a professor at the University of Central Florida, where I taught the third and fourth year medical residency psychiatry, and I taught psychotherapy.
Very cool.
So here is my background, my history.
That's awesome. I had a brief stint at the VA during my training at University of Cincinnati, so that was part of our residency training, and I loved working with the veterans, and that's part of the reason why PTSD sort of became one of my major focuses of study and clinical work. So I really, really enjoy working with that patient population. So now you are with Hello Mental Health and you're doing individual psychotherapy and you are doing ketamine assisted psychotherapy. Can you tell me a little bit about ketamine assisted psychotherapy and a little bit about how it differs from like traditional individual psychotherapy?
Absolutely. Ketamine assisted psychotherapy is a new type of therapy that requires the patient to go through a ketamine infusion treatments. In here, Hello Mental Health, we do in conjunction with your clinic, with the Anderson Clinic. So the patients receive the infusion at your clinic, as you know, and they come to me typically the following day for the therapy. And the therapy is heavily focused on what happened during the infusion. There are many, many differences between ketamine assisted psychotherapy and the traditional psychotherapy. For example, one is that ketamine assisted psychotherapy, we have to remember this patient went through a very potent drug treatment, which is the ketamine. You know? So during that ketamine infusion, the patient will go through what is called the psychedelic experience. And the psychedelic experience promote altered state of consciousness, which may include dissociative state. The person has a sense that the self is dissolving. There is also altered sensory perception. Anything that happened, any little noise, if let's say somebody make up, they hear a nurse, talking on the background, all these sensory experiences, they can be amplified when the person is taking ketamine. And they also go through changes in time and perception. The experience of time will change. When they have those experiences, they may gain insights, and there is hypothesized that the defensive mechanisms are going to be heavily diminished. When in traditional psychotherapy, when you have a patient, they're going to come to the session and they have not gone through those type of experiences. And the therapy in traditional psychotherapy is based either on insights that the person will gain during the psychotherapy or processing thoughts, emotions, or behavioral modification. They may be learning skills. So this is different from the ketamine. Again, the ketamine is very focused on what happened during the psychedelic experience.
Mm-hmm.
The traditional psychotherapy is going to be focused on what is the presenting problem they are coming to you, any situational problem they're facing, long-term problem. Another difference is the length in treatment. In ketamine-assisted psychotherapy, for example, typically the person will receive 6 infusions. So let's say, as for me, most of the patients will receive the infusions at your clinic on Monday, Wednesday, and Friday for 2 weeks, a total of 6 infusions. And so when they come to therapy, they will have sessions in between. So they will see me on Tuesday or Tuesdays and Thursday for the first week, and Tuesday and Thursday for the second week. And sometimes they may require a additional session. So we have 4 to 5 sessions, and then it ends. If the person wants or if they enjoy the experience, they can engage in individual therapy with me, but they are not required by any means. So as you can see, it's only 4 to 6 sessions. Traditional psychotherapy is typically longer. With me, a traditional psychotherapy will last from 3 months to a year, even 2 years. It will be a lot longer. So this is another huge difference, the duration of the treatment. Another difference is when is the session structure in itself. In ketamine-assisted psychotherapy or CAP, the patient will have a phase. If they have a chance to talk to me before, they will be prepared for the ketamine infusion. Then they will go to your clinic to have the ketamine experience, and they will come to me for the integration. So those 4 or 5 sessions they will receive with me are the integration. And what is the integration? What is this? Integration is to integrate the insights that they learned, their ideas that occur to their mind, the new thoughts during the ketamine experience. So they will integrate with the current daily living. And this is a major focus of the therapy. As you can see, the material for the psychotherapy is presented during the psychedelic experience. In the traditional psychotherapy, the structure is very different. This will depend upon what type of modality or therapy you are using. Some people use a more structured psychotherapy, like cognitive behavioral therapy. So they will have a very different structure, focus on the problem. There is education, educational part of it. Then there is learning how to either do thought processing, how to activate behaviors. And those, this structure will span through a longer period of time, as I mentioned before. Okay, and finally, we also have to remember that ketamine assisted psychotherapy is more acute. You know, what is going to be presenting for therapy is more acute versus what is going to be discussed in traditional psychotherapy. It's going to be longer term effect.
I've shared a
This
lot
helps, you
of,
know.
yeah, no, it's very helpful. I've shared a lot of patients with you guys, doing both ketamine infusions and ketamine assisted psychotherapy, and something that folks keep coming back to me and saying is how much more freely they can speak to the experience when their defenses are down. And I think that's part of the reason, in terms of the timing, that we want to do it like 24 to 48 hours after the infusion, because you've heard the old adage, in vino veritas, or in wine truth. There's some element to that with the ketamine. When your defenses are down and you can speak a little more easily to what's been bothering you maybe for years or your entire life, and folks have this sort of experience of having lowered defenses for a day or two post ketamine, and especially for our highly anxious folks, our generalized anxiety or panic disorder, our PTSD folks, and sometimes our OCD folks, a lot of times talking about the event or talking about what's actually troubling them causes them a great deal of anxiety. And so if we can lower their baseline anxiety, calm down that fight or flight a little bit, but also lower their defenses to be less inhibited to talk about the thing that brings them anxiety, they can get so much farther in treatment. I've had a number of patients come to me and said, "Oh yeah, I worked with Dr. Helmer. I felt like I got 6 months of therapy in like 2 weeks."
Definitely. Yeah. The ketamine work.
Momentum.
Yeah, so the ketamine work as a catalyst, for those defense mechanisms, and we take advantage during the integration. Okay, and this is why integration is also so important for two reasons. One, sometimes patients will have some experience during the ketamine infusion, and they will dismiss the meaning of that experience. Is not going, they won't be able to make a link. And two, they will not be able to integrate what is the meaning of this experience in my personal life, in my daily living, in my relationship with my husband, with my wife, or with my children, with my coworkers, in what is this relationship with me feeling overwhelmed every day. And they will gain a lot of insights. I make analogy of the ketamine experience as like in a dream. When you are dreaming, some of your defense mechanisms are going to go down, and you are also going to have altered state of experiences. For example, a person who may have died a long time ago may reappear in your dream, and during your dream, you are going to assume it's taken for granted the person is still alive, when in real life, that would be a very, very different experience. So, however, the person has the dream, and as the time goes by, the person will start to forget about what happened in the dream. Okay? And a day later, 2 days later, the person may have totally forgotten what happened during the dream. When they come for therapy, it will be very different because they had the dream the day before. They come and they will be talking about the dream. In a sense, they're going to be re-experiencing, not to the psychedelic level, but they will be reviewing, going through the experience again, and this will promote and will consolidate memory and better changes in the brain. So they're going to be able to process and they'll be able to extract meanings of those experiences before it dissolves and goes away. If you talk to patients who did not have the integration, and even like a week later, and you ask about, so how was your experience? They will remember having psychedelic experiences, but they will be describing very, very general terms. It's like if I say, oh, I had a dream with my grandmother who passed away, but I won't be able to remember a lot of important details that happen. Psychotherapy will facilitate the remembrance and the processing of those details.
And this is the same reason why we tell people that it's really, medications are important, therapy is important, but both together have shown the greatest efficacy towards getting you the healing that you need and the functionality that you want back in your life. And I think in the same way, we've seen a far greater efficacy, far greater improvement in functionality in the patients who've done both the ketamine infusions and paired it with the ketamine assisted psychotherapy, because you're getting these things out of your head, and then you're playing with them, you're playing with those ideas and symbols and meanings and dreams and remembrances, and you're consolidating them, and you're changing the trajectory of what they mean to you. And so you really can internalize some of the things that happen, and that happens in a much more rapid pace when you're
Very
having that
fast paced.
psychedelic experience, and then you're still working while your defenses are down and while it's still fresh on your mind.
Yes, and you mentioned something very important, which is the combination of medication with like psychotherapy. Not only because of my medical background in biology, I was also a biologist, no background. I am very, very supportive of medication. I'm inclined also to tell my patients, to seek psychiatrists for medication. Not only because of my background, but also simply because of scientific research. Take anxiety disorders, for example. There is overwhelming amount of research that shows that medication help anxiety, psychotherapy help anxiety, and the combination of both of them is the optimal treatment. It really one will augment the other. So it's
Absolutely.
like you're getting the best of both worlds. So this is why I'm so supportive of both of them. And in ketamine, assisted psychotherapy, you're already receiving both of them. You're having the medication, which is the ketamine, and then the therapy all at the same time happens simultaneously.
I love it. I love it. Well,
Mhm.
is there anything else that you'd like to share with our listeners before we go today?
Just that in addition to the ketamine assisted psychotherapy, and I'm highly trained in many different types of therapy. I am trained like in cognitive behavior therapy for anxiety, depression, obsessive compulsive disorders, chronic pain. I'm trained in what we call CBT, CP for chronic pain. And I did a lot of cognitive behavior therapy for chronic pain at the VA. I'm also trained in cognitive processing therapy for trauma, which goes well for PTSD. Coming after many years of VA, you learn so much about PTSD, and you receive a lot of like outstanding training. So I'm trained cognitive processing therapy. I also do exposure therapy. I also apply to anxiety disorders, including fear of driving, phobias. I do interpersonal psychotherapy for depression, which is interesting. It's a type we don't talk much, and people get confused between interpersonal psychotherapy for depression with the psychodynamics of the therapy. Interpersonal psychotherapy are evidence-based and is a very solid type of therapy applied for depression. I do dialectical behavior therapy or DBT. We also have a group here at Hello Mental Health that does exclusively dialectical behavior therapy. I am trained in mindfulness-based psychotherapy, schema therapy, and finally existential therapy, which is one of the also very powerful ways that I use to help my patients with existential problems about life, about meaning of who I am in this world, what do I want to be, what does what does the world means to me. So all of this in addition to the ketamine assisted psychotherapy.
You are a man of many talents.
Thank
I
you.
have to tell you, I have so enjoyed working with you, and I've so enjoyed working with everyone at Hello Mental Health. And I feel like my patients are in very good hands when I send people your direction. And I can say nothing but positive things about you guys. And so, if any of our listeners want to get a hold of you, get a hold of somebody at Hello Mental Health, how would they go about doing that?
They can, first of all, give us a call here at Hello Mental Health, and I'm looking for our contact number. They can contact Hello Mental Health, make a phone call, and they can make an appointment. Typically, so they will talk to our practice coordinator, Andrea, and she will go over about the costs for therapy, scheduling, and so forth. And then
Perfect.
she will schedule a first session with me. If they are reluctant and if they would like to talk to me first, I can do a consultation, 15, 20 minutes, and I can talk for a free consultation to see what the problem is, and they can ask me more additional questions, how I approach this problem, how I approach the other problem, and and so forth, you know. And then
That's
when after all that's done, if they decided the first session is typically a intake session, and then I will decide what therapy we are going to be working. And I decide together with the patient because in therapy I work together with the patient.
perfect. I love that. So I will list your contact number and your website on our link on our podcast. And in the meantime, if any folks are interested in the Cincinnati area contacting the Anderson Clinic, the number is 513-321-1753. And you can always follow us on Facebook or Instagram. And we also have a website at www.andersonclinic.net. Thank you, Dr. Helmer. You have been most enlightening today, and I'm so glad that we are collaboration partners.
I also simply adore working with you guys at Anderson Clinic. You know, I also appreciate your work with those patients. And I thank you so much for having me participate in this podcast.
Oh, my absolute pleasure. Have a great day.
You too. Bye bye.